The powerful painkiller is a deadly drug if not used as prescribed. Learn how people become addicted to it, and what can be done to stop it. Part 1 of 7. Drug abuse. What is drug abuse? Drug abuse is the intentional misuse of a prescription medicine. Abuse may mean people use their own prescription in a way it was not prescribed. Or, they may take a drug that was not prescribed to them. Prescription drug abuse in the United States continues to increase, according to the National Institute on Drug Abuse, NIDA. Prescription drug abuse can cause serious, sometimes fatal complications. Part 2 of 7. Percocet. What is Percocet? Percocet is the brand name for a painkiller that combines oxycodone and acetaminophen. Oxycodone is a powerful opioid. It's derived from the same source as morphine and some illegal drugs, including heroin. Opioids like Percocet activate the brain's reward center. You can become addicted to the way the drug makes you feel. But over time, the drug will stop working as well as it used to, and you'll need more of the medicine to achieve the same effect. Part 3 of 7. Signs of addiction. What are possible signs of Percocet addiction? Percocet reduces intestinal motility. This often causes constipation and difficulty with bowel movements. Opioid painkillers like Percocet cause a number of other symptoms, including confusion, mood swings, depression, difficulty sleeping or sleeping too much, low blood pressure, reduced breathing rate, sweating, difficulty with coordination. Part 4 of 7. Social signs. Social signs of Percocet addiction. Percocet can be difficult to obtain because it requires a prescription. Many people won't be able to obtain enough Percocet through legal means, such as a prescription from a doctor. Therefore, people who are addicted may try anything in order to get their next hit. Addicts may turn to stealing medication from friends, family members, or strangers, or forging prescriptions. They may pretend to lose their prescription or frequently request new ones. They may file false police reports so pharmacies will give them more medication. Some addicts will also visit multiple doctors or pharmacies so they aren't as likely to get caught. Percocet use and abuse can cause a person to develop obvious mannerisms like appearing high or unusually excitable. Some people also appear sedated or excessively tired. Part 5 of 7. Consequences. What are the consequences of a Percocet addiction? Opioids like Percocet can cause serious health complications. The drug can increase a person's risk for choking. It can also slow a person's breathing, which may cause them to stop breathing entirely. The user may fall into a coma or even die. A Percocet addict may be more likely to use other illegal drugs or prescription medications. Certain combinations of medicines can be lethal. An addiction can affect work performance and personal relationships. People who use and abuse Percocet sometimes engage in risky behaviors. This may cause motor vehicle accidents or accidents that cause bodily harm. Addicts may also find themselves involved in criminal activity, especially if they decide to steal, forge a prescription, or lie to get more pills. Part 6 of 7. Treatments. How is a Percocet addiction treated? Treatment for Percocet addiction often requires several approaches. Counseling. People who are trying to overcome addiction often turn to counseling. Speaking with a professional can help a person discover underlying problems that may have contributed to their addiction in the first place. Additionally, family members of an addict may want to use counseling as a way to talk with their loved one about their problems so everyone can come together to heal and move forward. Family members of addicts may need counseling to help them understand how they can support their loved one through the recovery process. Medications. It may seem ironic, but prescription medications may actually help a person addicted to prescription medications quit and recover from their addiction. Medications are often needed to help treat the symptoms caused by detoxification and withdrawal. This may make kicking the addiction easier. A doctor may prescribe buprenorphine or methadone for Percocet withdrawal. Both have shown great success at treating and easing the symptoms caused by opioid withdrawal. Support. Detoxifying your body and experiencing withdrawal is hard. But staying clean and drug-free for the rest of your life might be even harder. That's why the love of friends, family, loved ones, and a network of support organizations can help. Support can come from many places, such as the well-known organization Narcotics Anonymous. If you're religious, you may enjoy a church-based program, such as Celebrate Recovery. The important thing is finding something that helps you stay clean and holds you accountable. Part 7 of 7. Finding help. Find the help you need. Whether you're trying to assist a loved one or searching for a solution yourself, you can find help. Reach out to a family member you trust or a doctor if you're currently addicted to Percocet. Ask for help locating the resources you need, and work with your support group to find a treatment plan that works for you. If you're trying to help a loved one enter treatment, talk with a doctor or addiction treatment specialist about holding an intervention. Confronting someone about their addiction can be challenging, but ultimately it's the best thing for both you and your loved one.